Hi, Dr. Vo here. In today's video, I'm going to be going over my complete guide to cataract surgery for 2025. This video is going to be a compilation of some of my previous videos. I wanted to make a single video that included all the most relevant and important pieces of information that a patient might need when planning for their cataract surgery. This video will be separated into 5 sections with timestamps available in the description, so please skip around as needed. In section 1, I'll discuss what cataracts are, the signs and symptoms of cataracts, what the different cataract lens options are, what you should expect on the day of surgery, and what the recovery process is like after cataract surgery. In section 2, I'll walk you through step by step what happens during cataract surgery. You'll be able to watch me operate from start to finish. In section 3, I'll give you tips that my patients follow to avoid being unhappy after cataract surgery. I'll discuss things like when is the right time for cataract surgery and how to choose a cataract surgeon. In section 4, I'll walk you through Alcon's and Johnson & Johnson's online lens tool, which will allow you to simulate what your vision will be like with different cataract lens options, such as the Vivity, PanOptix, and Odyssey lenses. You'll be able to get an idea of what your vision will be like in everyday settings. Lastly, in section 5, I'll go over the top 20 questions I get asked by my patients about cataract surgery. I'll answer common questions like, does cataract surgery hurt? And can cataracts come back? So what exactly is a cataract? A cataract is a clouding of the natural lens of your eye. When you're younger, this lens is nice and clear, and it allows light to focus properly onto the retina, giving you a nice sharp vision. But as you get older and the cataract forms, the lens becomes cloudy. This makes it more difficult for light to pass through. As a result, your vision can become dim, blurry, or even take on a yellowish hue. Because cataracts form slowly, you might not even notice the cataracts forming. Day-to-day tasks, like reading or driving, may become increasingly more difficult and eventually even impossible to do. Cataracts are the leading cause of blindness worldwide, but it is also both treatable and curable. In most patients, cataracts develop as a result of aging. However, it's important to remember that other factors like diabetes, excessive exposure to UV light, a history of trauma, medication use like steroids, and smoking can all contribute to the formation of cataracts. So what are the symptoms of cataracts, or how do you know if you might be developing them? Some of the most common symptoms include blurring or clouding of your vision, difficulty seeing at night, light sensitivity or glare, especially while driving, fading or yellowing of colors, or frequent changes in glasses prescription. If you're experiencing these symptoms, it's important to get your eyes checked so that your doctor can evaluate and see if you have cataracts or if something else might be contributing to your symptoms. Now let's talk about available treatment options. The only definitive treatment option for a cataract is cataract surgery. During surgery, the cloudy lens will be broken down to small fragments and then removed through a process called phacoemulsification. The cloudy lens is then replaced with a clear artificial lens called an intraocular lens implant, or IOL. Now, if you're scared about surgery, just remember, more than 3 million cataract surgeries are performed each year in the United States, and more than 20 million surgeries are performed worldwide. That's more people than the entire state of New York. Cataract surgery remains one of the most commonly and successfully performed procedures to date. You don't have to have surgery if you don't want to, as it's an elective procedure. However, your vision won't improve until you do. If you decide that you're ready for cataract surgery, then the next step is to come for your preoperative assessment. During this visit, your doctor will take multiple measurements of your eye, including the shape, the length, the total refractive power, and also evaluate the health of the retina. It's important to come to this visit with some idea about what your refractive goals are. This is a combination of both your visual needs, but also lifestyle preferences. Your surgeon will ask you specifically about what activities you have a hard time with, whether it's reading, driving, or even golf. Your surgeon will want to know, as this will help determine what type of lens is recommended to you to best suit your personal needs. Next, we're going to be talking about the different lens options. There are many lens types to choose from, and the differences can be confusing for patients to remember. Now, let's dive into the different types of IOLs available. Remember, no one lens is perfect, and each has its own strengths and weaknesses. First, let's start with monofocal IOLs. These are the most common type of lens implanted. They provide clear vision at a single focal point, usually for distance vision. This means that after surgery, you will see clearly far away, but you will still need reading glasses for close-up tasks like reading a book or using your phone. Alternatively, you can choose to have your near vision corrected and wear glasses for distance-related tasks. Some people choose to have one eye corrected for distance and the other eye set for near vision. This is called monovision, which can reduce the need for glasses for many activities. The monofocal lens offers great visual clarity, high contrast sensitivity, and has the lowest risk for side effects like glares and halos. But you will have more limited range in vision when compared to other lens types. Next is the toric monofocal lens. Many of you have probably been told that you have astigmatism, but what exactly is astigmatism? Astigmatism is a refractive error that occurs when your eye is irregularly shaped. Instead of being round like a basketball, it's shaped more like a football. This causes light entering your eye to not focus properly onto the retina, resulting in blurry or distorted vision. If you have astigmatism, a toric IOL might be recommended to you. Toric IOLs are specially designed to correct astigmatism, allowing for clearer vision without the need for additional astigmatism-correcting glasses after surgery. Remember, this is still a monofocal lens, so you will still need reading glasses after surgery. Next are the multifocal and extended depth of focus IOLs, which are both considered premium lenses because they aim to provide a wide range of vision, reducing or possibly even eliminating the need for glasses entirely. Multifocal lenses have multiple focal points, allowing you to see clearly at distance, intermediate, like computer screens, and at near. This includes lenses such as Bausch & Lomb's Envy, Johnson & Johnson's Odyssey, and Alcon's Panoptix. They work by using concentric rings built into the lens surface. This causes splitting of light to provide clear vision at different distances. If your priority is to have a wide range in vision, this is the lens that you will want to consider. While many people achieve excellent spectacle independence, some people may experience halos or glare around lights, especially at night. For most, the side effects are not significant and improve over time. The extended depth of focus IOLs are a newer class of lenses. This includes lenses such as Alcon's Vivity lens and Johnson & Johnson's Piercy. They provide a continuous range of vision, typically from distance to intermediate, with functional near vision. These lenses aim to provide a smoother transition between distances and typically have less glare and halos when compared to multifocal lenses. They provide functional near vision, meaning that for most activities you won't need glasses, but you should still expect to need reading glasses for small or fine print. Next, we have the light adjustable lenses. This is a premium monofocal lens that uses a newer lens technology that offers a unique advantage. The lens power can be adjusted after it has been implanted in your eye. This is done using a special UV light delivered in your surgeon's office. After your cataract surgery and initial healing, you will visit your ophthalmologist several times. During these visits, your vision will be tested, and based on your visual needs, your doctor will apply UV light to the light adjustable lens. This light exposure changes the shape and the power of the lens, fine-tuning your vision to your specific needs. Once the desired result is achieved, a final light treatment locks in the lens power, preventing further changes. The light adjustable lens allows for precise customization of your vision. This can be beneficial for individuals who have complex prescriptions or those seeking the most accurate vision correction possible. So, how do you choose which lens implant is right for you? Choosing the right lens is a personal decision that you will make with the help of your ophthalmologist. Here are some things that you should take into consideration. Step 1, consider the cost. First, decide if you're willing to spend money out of pocket for your lens implant. The standard monofocal lens will be the cheapest option as most insurances will cover the cost of the lens. All the other lens options discussed, such as the toric, multifocals, extended depth of focus, and the light adjustable lens are not covered by insurance and have an out-of-pocket cost. This can cost you thousands of dollars per eye, so first decide if it's a worthwhile investment to you. Discuss the cost with your surgeon's office. Some offices may offer payment plans to help with financing. Step 2. Assess your vision needs and lifestyle. I would ask yourself, Are you willing to wear glasses after cataract surgery, or do you want to minimize your dependence on them as much as possible? What are your daily activities? Do you spend a lot of time reading, on the computer, driving, or engaging in hobbies like golfing or sewing? If your goal after surgery is complete spectacle independence, then the multifocal lenses are the best option for achieving that goal. The extended depth of focus lenses or opting for monovision will provide you more functional near vision, meaning that you'll be less dependent on your reading glasses, but may still occasionally need them. If you don't mind wearing glasses, then the standard monofocal lenses would still be a good option. Step 3. Understand potential trade-offs. Remember, no lens type is perfect, and none can give you the vision you had when you were 20. Every lens has its advantages and disadvantages. The standard monofocal lens, including the monofocal toric lens, offers excellent clarity at one distance with great contrast sensitivity, but requires glasses for other distances. There is minimal risk for side effects like glare and halos. Multifocal lenses, on the other hand, are the best option if you want to be completely glasses-free. However, these generally have higher costs, and some individuals may experience halos or glare. The extended depth of focus lenses offers good distance and intermediate vision with functional near vision. These lenses can reduce your dependence on glasses, but not entirely. There is less risk for halos and glares when compared to true multifocal lenses. The light adjustable lens offers more customized vision because the lens power can still be adjusted after surgery. This is great for those with complex prescriptions, prior refractive surgery, or those requiring very precise results. This is the most expensive lens option discussed though. Step 4. Discuss your eye health and anatomy with your surgeon. First consider, do you have astigmatism? Your doctor will measure this during your preoperative evaluation. If there is significant astigmatism, you should strongly consider getting a toric lens. If you don't correct your astigmatism, it's likely that your vision will still be blurry even after cataract surgery. This can be corrected with prescription glasses, but many patients choose to have cataract surgery with the expectation of reducing their dependence on glasses. Second, do you have pre-existing eye conditions? Conditions such as glaucoma, macular degeneration, or previous eye surgeries may make you a poor candidate for a multifocal or extended depth of focus lens. This is because these conditions may limit your eye's visual potential, decrease contrast sensitivity, or introduce abnormalities that can interfere with how these lenses work. Your doctor will assess your eye's overall health and inform you on which lens options are appropriate for your eyes. Lastly, step 5. Make an informed decision with your ophthalmologist. Based on your lifestyle, visual needs, eye health, and a thorough discussion of the pros and cons of each lens type, you and your ophthalmologist will decide on which lens is best for you. Don't hesitate to ask questions and express any concerns you have. Take the time to carefully decide on which lens is right for you. Remember, these lenses will be with you for the rest of your life. Now to discuss the two methods of doing cataract surgery. First, we have the traditional routine method, and then we have the newer frontal laser-assisted cataract surgery, also called FLACS. During the traditional cataract surgery, the entire surgery is done by hand. During laser-assisted cataract surgery, a femtosecond laser is used to assist with certain steps of routine cataract surgery. The laser can also be used to pre-soften the cataract, making removal of the cataract easier. This may reduce inflammation and swelling, but it may also shorten recovery time. The laser can also be used to correct small amounts of astigmatism. The steps performed by laser can make the overall surgery slightly more precise than that of the traditional method. Both methods of cataract surgery are great and can have fantastic visual outcomes. The main difference really will come down to the cost, as your insurance will only cover the cost of traditional cataract surgery. For my patients, I typically recommend FLACS if either 1, they're opting for a premium lens option, as this can help with lens centration, or 2, if they have certain eye conditions, such as Fuchs endothelial dystrophy, as I want to make sure I use as little energy as possible when removing the cataract. Regardless of which method you choose, either traditional versus FLACS, it's important to remember that the most important factor in determining your visual outcome is the lens implant that you choose. While cataract surgery is largely considered a very safe and low-risk procedure, it's still surgery, and so there are risks. This includes infection in the eye, bleeding in the eye, swelling of the cornea or retina, retinal detachment, permanent drooping of the eyelid, need for additional surgery, loss of some or all your vision. More minor risks include dry eyes, mild persistent inflammation, and the formation of what's called a secondary cataract, also known as posterior capsule opacification. So what can you expect on the day of surgery? Most surgeries take place in an outpatient surgery center. So on the day of surgery, you'll come in, an IV will be placed, dilating drops will be placed inside the operating eye. Afterwards, you'll be brought back to the operating room. There, the eye will be cleaned, a drape will be placed over your face, and an eyelid speculum will be used to help keep your eye open. You'll receive a combination of both local anesthesia and conscious sedation. This will help keep you relaxed and pain-free during surgery. Surgery typically will last anywhere between 10 to 20 minutes. During surgery, it's important to stay relaxed, but also to keep talking and movements to a minimum. Once the surgery is done, a clear eye shield will be placed over your eye and you'll be taken back to the recovery area. Once the sedation has worn off, you'll be able to go home the same day. Most patients experience improved vision within a couple days of surgery. After cataract surgery, it's normal to experience mild discomfort, itching, or even sensitivity to light. Your doctor will prescribe you a series of eye drops that will help control the inflammation but also help prevent infection. You will usually go home with 3 types of eye drops. Here's how to use them. The first is an antibiotic drop. This is to prevent infection. Typically, it will be either moxifloxacin or ofloxacin, which has a tan-colored cap. Use 1 drop in the operated eye 4 times a day for 1 week. The second drop is a steroid drop. This is to reduce swelling and inflammation. Typically, you'll receive either prednisolone or difluprednate. These will usually have a pink or white color cap. Use 1 drop 4 times a day for 1 week. You will then need to taper the eye drops. At week 2, you'll go down to 1 drop 3 times a day. At week 3, you'll go down to 1 drop 2 times a day. And then at week 4, once daily. The third drop is a non-steroidal anti-inflammatory drop, which is also used to reduce swelling and inflammation. This will typically be either Cataract or Bromfenac, which has a gray color cap. Use 1 drop once daily for 4 weeks if you receive Bromfenac, or 1 drop 4 times daily for 4 weeks if you receive Cataract. Now, some general precautions. Please wait 5 minutes between drops. Make sure to always wash your hands before handling your eye drops. Don't touch the dropper tip to your eye as you may contaminate the bottle. After surgery, please avoid the following. Number 1, no touching or rubbing the eye. Sutures are not typically used during cataract surgery, so rubbing your eyes can potentially open the incision made. Number 2, no heavy lifting, bending over, or straining for 1 week. Number 3, no swimming, hot tubs, or getting water in the eye for 2 weeks. Shower from the neck down for 1 week. Number 4, avoid dusty or dirty environments. So what can you do after cataract surgery? It's okay to do light activity like walking, reading, or watching TV, even if right after surgery. Please make sure to wear your protective eye shield while sleeping for 1 week. If you're going outside, wear sunglasses to reduce light sensitivity and to protect your eyes from wind and dust. After surgery, you may experience slight blurriness or glare, a gritty or scratchy feeling, mild redness or tearing. All of these are common and normal symptoms and should improve over the first few days. However, please call your surgeon if you experience the following: sudden vision loss, severe pain, increasing redness or discharge, or flashing lights or a shadow in your vision. Starting with number 1, my happiest patients, they don't rush into surgery. It's important to remember that just because you have a cataract, it does not mean that you need to have cataract surgery now. For most patients, cataracts form slowly as a result of aging, and so waiting weeks months, and even sometimes years may not have a significant impact on your cataracts. I always ask my patients why they want to have cataract surgery. If your reasons are, I was told I have cataracts, or my friends all had cataract surgery and said it was the best thing ever, or I have cataracts and I'll need surgery anyway, so why not get it done now, are actually not good reasons to have surgery. You should have cataract surgery when it's starting to negatively affect your overall quality of life. Good reasons would include, I don't feel safe driving at night because of the glare, or I love reading, but it's so difficult doing it now, or I can't watch my favorite TV shows because it's just so blurry. I let my patients know when I think their cataracts are mature and visually significant enough for surgery, but ultimately I let them decide, is the time for surgery now or is it later? Number 2, my happiest patients choose the right surgeon. Cataract surgery is one of the most important and transformative surgeries every patient gets to experience. Even though surgery itself is only around 15 minutes, the decisions you make regarding your surgery will impact you the rest of your life. And the first step is choosing the right surgeon. Take the time to research and find the surgeon you are comfortable with and confident in. Here's how I would approach choosing a surgeon. First, you can search online. Great places to look would include Google or Yelp. Alternatively, you can ask on forums such as Facebook or Reddit for recommendations for a surgeon near you. Once you have someone in mind, find more information about them online. Most surgeons now have a digital footprint, and you can find a lot of information about them. You can find reviews and see what others say about them. Check websites such as WebMD, Healthgrades, Vitals. You can also check if they're board certified by going to the American Board of Ophthalmology website and verifying their certification status. Another great resource for recommendations, and maybe even the most valuable one, is to ask people you actually know. If you have friends, family, or coworkers who have had surgery, see if they recommend their own surgeon. Once you have a surgeon picked, go ahead and schedule a consultation. During your consultation, pay attention to everything. How does their staff treat you? How does the surgeon treat you? Do they take the time to explain the different lens options to you, or do they only push the most expensive ones? Do you feel confident in your surgeon? Do they take the time to understand what your goals and expectations are for surgery? How easy is it to communicate with them? At this time, you still don't have to commit to the surgeon. If anything feels off, or you don't want to proceed with surgery, don't feel bad if you want to get a second opinion or to go with a different surgeon. Remember, it's your eyes and you're the only one who will have to live with the outcomes of the surgery. Number 3, the happiest patients choose the right lens for their needs. Choosing the right lens is even more important than choosing the right surgeon. If you're not spending the time to do research and read about the different lens options available, then you are doing yourself a disservice. The right lens is not always the fanciest or the most expensive ones. It's the one that best suits your personal needs and lifestyle. Do you mind wearing reading glasses? Do you drive a lot at night? What activities are most important to you? Take the time to decide if that means a monofocal lens, or an extended depth of focus lens, or a multifocal lens that is most appropriate for your needs. Be clear and direct with your surgeon about what lifestyle you want to have after cataract surgery so that they can help guide you in the right direction. There are lots of options available and it can be overwhelming. Number 4, the happiest patients, they come prepared and ask questions. When you come to your consultation, this is the time to ask all your questions. The patients who will leave the happiest usually ask thoughtful and insightful questions. They want to know things like, will I still need reading glasses? What side effects should I expect? What's the recovery process like? What are the advantages and disadvantages of each lens? These patients come in as partners in the process, not just passive participants. Number 5, the happiest patients, they have realistic expectations for surgery. Cataract surgery isn't the same as laser eye surgery that you can have in your 20s. None of the lenses can fully replicate the vision you had in your youth. Each lens carries its own advantages and disadvantages, and so remember, cataract surgery is about restoring clear, functional vision to the patients. My happiest patients understand that sunglasses may still be needed, and that's okay, or that there may be side effects like glares and halos with certain lenses. The mindset shift makes all the difference. Take the time to discuss thoroughly with your surgeon so that you are on the same page about expectations after surgery. Number 6, the happiest patients, they follow the post-op instructions exactly. Please make sure to follow your post-op instructions carefully. Use the eye drops as instructed, avoid rubbing your eye, avoid getting water in your eye. These things actually matter a lot. Cataract surgery is a short recovery, but the happiest patients treat those few weeks seriously and with care. That gives their eyes time to heal properly and comfortably. So, in summary, the happiest patients, 1, they didn't rush into surgery. 2, they took the time to choose the right surgeon. 3, they took even more time to choose the right lens. 4, they asked questions. 5, they have realistic expectations. And lastly, 6, they followed all the post-operative instructions exactly. So this is a IOL simulator made by Alcon, which is one of the leading makers for IOLs. I'm going to use a screen record so that we can walk through the simulator together. The URL is at smartedgecare.myalcon.com, and again, it's completely free. So the first thing you're going to want to do once you're on this page is click Launch Simulator, and then you'll be taken to this starting page. Here you'll see on in the middle of the screen there's a divider. There's 2 halves. On the left side is what your vision is like with the cataract, and then on the right side is what your vision will be like if you had a monofocal lens implant. Now, the image is structured in a way to really emphasize or focus on 3 focal points. And so you have your distance vision, which is here at the back. This is the coffee sign. And then you have your intermediate vision, which is up here on the laptop, which is about arm's length. And then here, for your near vision, you have it represented by this coffee cup. And so you have a mug here. And you're able to use the slider at the bottom. So I'm going to go ahead and drag the slider all the way to the right to show what your vision would be like with a cataract. And you can see that everything is more or less really quite blurry. So your distance vision here, the coffee sign, it's completely blurry. The computer screen, blurry. And then here on the mug, all the text is quite blurry. Now, if you drag your slider all the way to the left to illustrate what your vision will be like after having a monofocal lens implant, you'll see that the distance vision clears up quite nicely here. So you'll have great distance vision, but again, you'll struggle with the intermediate and the near vision. So you can see here on over here, the computer screen, it's quite blurry, the text, and then even your coffee cup, really all the text is quite blurry. Now, what you can do next is down here at the bottom, you can click either the cataract or the monofocal lens, and you can choose a different option. So here I'm going to click the cataract, and then we can go ahead and switch it to the Vividity lens, which is their extended depth of focus lens. And then on the right, I will go ahead and choose a different lens as well. So I'm going to go ahead and choose the Panoptix. And so here we have the Vividity on the left and the Panoptix on the right. And so if you look at the distance vision, and so let's say we drag the slider all the way over to the right, we can see that the sign at the back is more or less equally clear with both the Vividity and the Panoptix. And then if we go to the intermediate range, which is the laptop, I'll go ahead and drag the slider all the way over. Again, you can see that this computer screen is more or less equally clear with both the Vivity and the PanOptix. The real main difference between these two lenses is at the near range. And so if we slide this over to midway between the coffee cup, you can see here that on the right side with the PanOptix, the text on the cup is actually quite clear, whereas on the left side, the Vivity lens, the text is slightly blurry. And so usually that's why if you're getting the Vivity lens, you should plan on possibly needing reading glasses for fine print, whereas with the PanOptix, it will give you really the full range of vision. Now, the next thing that you can do with this simulator is down here at the bottom. You can toggle it between nighttime and daytime. So I'm going to go ahead and toggle the nighttime vision. And then here you can kind of see what your vision would be like if you're driving. And so the real big difference between the Vivity and the PanOptix is that there's slightly higher risk for having glare and halos with the PanOptix compared to the Vivity lens. And so if you drag this slider over and we're looking at this car, for example, you can see here that on the left with the Vivity, the light looks more or less completely normal, whereas with the PanOptix on the right, you're getting a little bit more of the haloing effect. And you can do it over here with this car as well. And you can kind of see that represented with the PanOptix, a little bit more of the haloing, whereas with the Vivity, the optics are really quite clear. At the top, you can play around with the amount of haloing that you get. So this is more of a severe amount of haloing. From my experience, most patients that do get the PanOptix haven't really reported any significant haloing or glare. So from my experience, it's been much more mild or non-existent, but you can go ahead and play around with those settings. Now, the last thing that you can do on the simulator is you can also play around with the astigmatism. And so you can click this astigmatism toggle down here at the bottom, and I'm going to go ahead and go with moderate amount of astigmatism. Okay, so now that we've turned the astigmatism on, I'm going to go ahead and turn this back to a monofocal lens. And on the right, we'll turn on monofocal toric. This is just to illustrate that if you have significant amounts of astigmatism, it really can affect your overall vision quality, even if you've had cataract surgery. And so if we take this slider and we drag it all the way over to the right, you'll see that, depending on the severity of your astigmatism, even your distance vision with the monofocal lens can still be quite blurry. And so if you have astigmatism, you might want to opt to have a toric monofocal lens. And you can see here side by side that the vision at distance at least really does clear up. However, with the monofocal toric, because it's a monofocal lens, the vision at the intermediate and the near range will still be blurry. Now here at the bottom, we can go ahead and switch it to the Vivity toric and the PanOptix toric, which is more or less similar to what we were showing previously. With the PanOptix here, you can see that the distance vision, the intermediate vision, and your near vision will be nice and clear, whereas with the Vivity toric, again, the distance and intermediate vision, so distance vision here, intermediate vision here, really quite clear, and then your near vision here at the cup, still, the larger text readable, but a little bit more blurry than you would get with the PanOptix. And that's pretty much it for this simulator. In today's video, we'll be covering the J&J IOL simulator. So they're a little bit different, but still pretty similar. We'll go ahead and pull this up on my screen. Again, this is a completely free tool that you can find online. I'll have it linked down below in the description, and you can go ahead and turn it on. This one works on both mobile and desktop, whereas the Alcon one is only usable on the desktop. So this one gives you a little bit more flexibility if you only have a mobile phone to try it. This is kind of the home page for the website, and it's a little bit different, but we'll go ahead and walk through all the different settings that you can try. Down here at the bottom right, you'll see the simulator settings. So I'll go ahead and let's start out with the day-to-day. There's a toggle here, you can toggle compare, so we'll go ahead and toggle compare. So this is the default cataract. On the left here and the right, I guess, is what your vision will be like if you had cataracts. I'm going to go ahead and choose a lens here, and we'll go ahead and go with the Technis monofocal IOL. So this is J&J's monofocal lens, and you can kind of see here side by side the difference. The monofocal lens, you'll get the distance vision, intermediate vision, but then at the near, you'll have a hard time seeing. So if you look at this video here, I'm going to actually pause the video that they have running. So here you can see here that this person is trying to look at their shopping list on their phone, and everything is quite blurry. And then the video will loop back, and we'll wait for it to loop. Here's at the start, so you can see here the distance vision on the right, everything is really quite clear, and then the intermediate vision, which is supposed to be represented by the fruits down here at the bottom, still a little bit blurry. Now we'll go ahead and change the left side, and I'm going to go ahead and choose the Symphony lens. So this is their EDOF lens, kind of the equivalent or analogous to the Vivi lens provided by Alcon. And so again, we'll go ahead and look at this picture side by side, but you can see here at the distance vision, all the fruits are really quite clear, but then your shopping cart, your shopping basket down here at the bottom, with the Symphony lens really quite clear, whereas with the monofocal lens, it's still quite blurry. And then we'll go ahead and let this run a little bit, and we'll get back to where they had the shopping list on their phone. They were trying to read it. So go ahead and pause again. You can see here on the left, the shopping list is readable on the phone, whereas with the monofocal lens, it's really quite blurry. Now, their multifocal lens, I'll go ahead and put that up, which is the Technis Odyssey lens. And again, every time you change the lens, it'll start at the beginning of the video again. Here you can see the distance vision for both, really quite clear, and then the intermediate vision with the baskets. The fruits all look really nice and sharp. And then lastly, at the end, here you're looking at the shopping list. I'll go ahead and pause with the Symphony on the left, which is the EDOF. Readable, but still a little bit blurry, whereas with the Odyssey, which is their kind of full range multifocal lens, all the text is really quite clear. Now I'll go ahead and change the environment. We'll go ahead and go to the night driving. And let's go ahead and go back to the monofocal lens, and we'll do that side by side with the Symphony lens. Looking at the image starting out, on the left with the monofocal lens, the distance vision really quite clear, but the GPS or the map here in the car, which would be more of an intermediate range, is still quite blurry. Whereas on the right side of the screen with the Symphony lens, you get a little bit of haloing with the lights. The intermediate range is quite clear here at the bottom on the GPS. We'll let that run a little bit, and then we can go ahead and actually switch the monofocal lens to the Odyssey. And then we'll go ahead and pause that. So again here, with the distance vision, you're seeing a little bit of haloing with the lights with both the Odyssey on the left and the Symphony on the right, but the GPS here with the Odyssey, a little bit sharper and a little bit clearer than the Symphony lens. So next I'm going to go ahead and switch this to the dining environment. And again, you can kind of see these side by side. The menu, which this person's holding with the Odyssey, definitely your near vision is really quite sharp and clear, whereas with the Symphony lens, which is more of an EDOF lens, still a little bit blurry here, okay? Now, the other things that you can do with this simulator, which is quite nice, is that you can go back to the eye condition and you can change this to cataracts with astigmatism. And we'll go ahead and put up the monofocal lens up here on the right. And so if you're looking at the astigmatism here, if you have astigmatism, even though you're getting the monofocal lens, which is represented on the right, you can see here that the person's face is still a little bit blurry. The picture frames on the wall, they kind of have a ghosting effect. And then of course the near vision, which is this menu, it's still really quite blurry. And so on the left, we'll go ahead and choose the Technis Toric IOL, which is a monofocal lens again, but will correct for your astigmatism. And so you can see here now, kind of all that ghosting that you had on the picture frame in the man's head is all quite nice and sharp. But again, because it's a monofocal lens, you won't get that intermediate or near range. And so things up close, like this menu, is still going to be really quite blurry. And then we can go ahead and switch the Technis monofocal here on the right to the Symphony lens, just to do a side-by-side comparison. Again, distance, image, the picture frames, the gentleman, all quite clear. And here at the menu, you can see that with the Symphony lens, much clearer than the monofocal lens. And now I'm going to go ahead and switch the left side to the Odyssey, which is, again, the full range lens. And you can see the two side by side, much sharper reading vision with the Odyssey when compared to the Symphony lens. Okay. There is one lens in here that I didn't discuss too much. If you actually select the lenses down here at the bottom, there's one that, well, actually, let me go ahead and turn the astigmatism off. You can see here down at the bottom that there is a Technis Eyehance, which is supposed to be kind of between a full EDOF lens and a monofocal lens. I'll go ahead and toggle that so we can kind of compare them side by side. And the monofocal lens here. The Eyehance, as per J&J at least, is supposed to give you a slightly, little bit more range than the plain monofocal lens would. And so if you're looking at this picture here, for example, again, gentleman's head, nice and sharp, the picture frames all nice and clear, and then reading at the menu, the monofocal, plain monofocal on the right, which is really quite blurry. The Eyehance gives you a little bit range. You can kind of start to see the text on the menu, but still not really quite readable, okay? And so that pretty much covers the main difference between this IOL simulator and the one made by Alcon. Again, they're both pretty similar and maybe a little bit more tailored to their specific products. I think in actual practice, the patient's final visual results probably will vary a little bit. So I think this is a great tool to be used as a guide to help give you an idea of what each lens would look like, but again, shouldn't be a exact representation of what your vision will finally be like. Any questions you have, please discuss with your surgeon. They can really kind of tailor and give you the specific answers to your questions, okay? In today's video, I'm answering the top 20 most common questions my patients ask me about cataract surgery. I'll answer common questions such as, how long does cataract surgery take? And can cataracts come back? Let's start with question number 1. What is a cataract? A cataract is the clouding of your eye's natural lens. When you're young, this lens is nice and clear. But as you grow older, the lens becomes more brown and opaque. Think of it like a window that's fogged up, making your vision blurry, hazy, or dim. During cataract surgery, the cloudy lens is removed and then replaced with a clear artificial lens called an intraocular lens implant. Question number 2. When should I have cataract surgery? We don't base that decision on a specific age or vision chart score. It's based on your lifestyle. If you struggle with driving at night because of glare, or if reading is more difficult, or if you notice colors aren't as bright as before, or if your glasses prescription keeps changing but your vision still isn't clear, then surgery makes sense. If cataracts affects the things you enjoy doing or need to do safely, then it's time for surgery. Question number 3. Is cataract surgery safe? Yes. Cataract surgery is one of the safest and most successful surgeries in modern medicine, with success rates over 95%. As with any surgery, there are risks, but serious complications are extremely rare. Nearly 30 million cataract surgeries are performed each year around the world, with roughly 4 million performed in the United States alone. Question number 4. Does cataract surgery hurt? No. Most patients feel little to no pain. You will receive a combination of local anesthesia and light sedation to keep you pain-free and relaxed. You might feel some pressure during surgery, which is completely normal. Afterwards, some patients describe scratchiness or mild irritation of the eye, like having an eyelash stuck in the eye, but this usually improves within a day or two. Question number 5. How long does the surgery take? The actual surgery itself usually only takes about 10 to 15 minutes per eye. However, plan on being at the surgery center for about 2 to 3 hours to check in, meet with the surgical team, and to have your eyes dilated and IV placed. You'll be observed in the recovery area for a short period of time after the surgery as the anesthesia wears off before you go home. Question number 6. What types of lenses can I choose from? There are different lens implants options available called intraocular lenses, also known as IOLs. The standard lens gives you great distance vision, but will require glasses for reading. Premium lenses like multifocal or extended depth of focus lenses can reduce your need for glasses either partially or entirely. Question number 7. What's the recovery process like? Most people notice better vision within a day or two. Expect your vision to be a little hazy, watery, or sensitive to light at first. Within a week, most people notice a big improvement, and the vision continues to sharpen for several weeks afterwards. You'll use eye drops for a month as your eyes fully heal. I recommend avoiding heavy lifting or rubbing your eyes during the early healing period. Question number 8. Are sutures placed during cataract surgery? In most cataract surgery cases, we usually do not need to place stitches. The incision we make is very small, typically just 2.5 millimeters, and it's designed to be self-sealing. That means it closes naturally on its own as the eye heals. Sutures are rarely required, but there are certain situations where we may use them. For example, if the incision needs extra support, if the eye is unusually soft, or if there's some complication during surgery. If a stitch is placed, it's usually tiny and painless. It can be easily removed in the clinic once the eye has fully healed. Question number 9. Will I need glasses after surgery? This depends on the lens type you choose. With a standard lens, you'll likely need reading glasses after surgery. With premium lenses like multifocals or extended depth of focus lenses, you can reduce your dependence on glasses for most activities, but it's not always guaranteed that you'll be completely glasses free. Question number 10. Can cataracts come back? No. The cataract itself does not come back because the cloudy lens is completely removed during cataract surgery. However, months or years later, a thin cloudy membrane can form behind the new lens. This is called a secondary cataract. It's easily treated with a quick, painless laser treatment performed in the office. No additional surgery is required. Question number 11. What are the risks of cataract surgery? Risks include infection, bleeding, retinal detachment, and swelling. The good news is, with modern techniques, serious complications from cataract surgery are very uncommon, and most are easily treatable if caught early. Question number 12. Is cataract surgery performed with the laser? Traditionally, cataract surgery is performed with tiny instruments using ultrasound energy to break up the cloudy cataract. In the past decade, femtosecond laser technology has been introduced to help with some of the steps of surgery, like making precise incisions or softening the cataract before removal. Laser-assisted cataract surgery can be very precise, but it's not necessary for everyone. Many surgeons achieve excellent results with just standard techniques, and insurance usually doesn't cover the cost of using the laser, so it may be an out-of-pocket upgrade. If you are interested in having laser cataract surgery, be sure to discuss it with your surgeon. Question number 13. Is cataract surgery done on both eyes at the same time? In the US, we typically do one eye at a time, often a week or two apart. That way, we can make sure that the first eye heals well before moving on to the second. In some countries, both eyes may be done the same day, but it's less common here for safety reasons. Question number 14. Can I switch out my lens after it has been implanted? If there's a strong reason, like the lens power wasn't quite right, or if you're not satisfied with the premium lens due to side effects like glare and halos, it is technically possible to exchange the lens. Lens exchange is a more complex surgery than the original cataract surgery, and it carries slightly higher risk, so it's not something we recommend lightly. The good news is, with modern measurement techniques and planning, it's rare for patients to need a lens swap. Question number 15. Can cataract surgery fix my astigmatism? Yes. If you have astigmatism, we can correct it during surgery using a toric lens implant or by placing tiny incisions into the cornea. Correcting astigmatism at the same time as cataract removal will give you sharper, clearer vision. Question number 16. How long does the artificial lens last? The cataract lens implant is designed to last forever. It doesn't wear out, and you don't need to replace it. Once it's in, it stays in. Question number 17. Can I drive after cataract surgery? You will need someone to drive you home on the day of surgery because the sedation and dilating drops can affect your vision, making it unsafe to drive. Most patients notice big improvements within a couple days, and many are able to safely drive very soon after surgery, sometimes even the next day if their vision is clear enough. I always advise waiting until your first post-op checkup before getting back behind the wheel, just to make sure your vision is up to safe driving standards. Question number 18. Do I need to take time off from work? This depends on the type of work you do. Many people with desk jobs or light work return in just a couple of days. If your job involves heavy lifting, dirty environments, or the risk of getting something in your eye, you may need a week or more before going back to work. Most patients feel comfortable resuming normal daily activities quickly. It's important, however, to protect your eyes while it's healing and to avoid anything that could increase the risk of infection or injury. Question number 19. Can I travel after cataract surgery? Yes. It's usually safe to travel, including flying, within 24 to 48 hours after cataract surgery. However, please make sure to consult your surgeon before doing so. Lastly, question number 20. How much does cataract surgery cost? For most patients, Medicare or private insurance covers standard cataract surgery and a basic lens implant. Your health insurance, however, will not cover premium options like multifocal or toric lenses or laser-assisted surgery, which may involve extra out-of-pocket costs. Discuss with your surgeon to get a clear estimate before surgery so there are no surprises. That's it. That's everything you need to know about cataract surgery. If you watched all the way to the end, I hope you found it useful. If you enjoyed the video and would like to show your support, please make sure to like and subscribe. If you would like to learn more about the eyes and cataracts, please click the recommended video up on the screen. I'll see you in the next video. Take care. Bye.